practical works in my class. Um, Now, the way that I give the practical exam is a little bit different than uh, the traditional sense of how a practical exam is given. Now, a practical exam, historically, you could say, is based on the medical school gross anatomy course. And that's a course where medical students dissect a cadaver, and they're tested on that essentially by their instructor coming over to their specimen and pointing at different structures that they've dissected out and asking them to name those structures. That's not really possible in our class because we're not doing cadaver dissections. But instead, my colleagues do the same sort of thing by using models or specimens or pictures or something like that in place of the dissected cadaver. And the students would come in to take that test. Everything would be set up around the room, and the students would move from station to station. This is a picture sort of depicting what that would look like. So all the students are answering questions on the test based on what's in front of them, and then they move to the next station to answer the next question. That's the traditional sort of practical exam. I don't like to teach this way because I don't think it's appropriate for what you're trying to get out of this course. So I'm reinventing or reinterpreting what practical means. Instead of the practical aspects of what you're looking at in lab so much, I'm reinterpreting it to be a test on practical real world information. So the test is designed around case studies. Now, there are 4 case studies. You can see them by clicking on the Practical 1.2a Cases link, which will take you to this document. The first case should have been discussed in class. If not, I believe I provided a YouTube link to a previous year's explanation of that case. You can go back into the announcements on Blackboard to find a link to that, I'm sure. If you can't, please let me know and I'll try to find that link again. This is a case about the autonomic system. Case 2 obviously is about diabetes, and case 3 is about somebody with chest pains, which means that they have problems with their heart. And in fact, it says down below that they have congestive heart failure, which is often associated with heart attacks. And then case 4 is a university professor who went to South America and forgot to be prepared going down there and came back with more friends than he'd expected, i.e. he got malaria. These 4 cases are meant to cover all of the material that's been presented at this point in the semester. There's the autonomic system, the endocrine system, and the cardiovascular system. Now, you might question why there's not a specific case about the sensory systems. To some degree, I've left that out because I feel it's really more of an A&P 1 topic. It's like we don't quite finish A&P 1 until the first week of A&P 2. But also because it's easy to put sensory systems into other cases. Now, the autonomic case can touch on sensory systems because you need sensory information to let the autonomic system know how to regulate what's going on in your body. Also, in diabetes, there's a common complication called peripheral neuropathy, and that often as it's said in this case here, diabetic neuropathy. And that often presents with damage to nerves in the sensory systems. So it's built in there. Also, while there are 2 cases in the cardiovascular system, one obviously about the heart and one obviously about the blood, it seems like the blood vessels would be left out. But of course, the heart pumps the blood through the blood vessels. So all of that's included. You can expect that blood vessels will be included within the cases 3 and 4. So that's the idea. It's a practical exam looking at real world clinical situations. Now, it's sort of my bias to have those be more medical cases. You might not be going into nursing or related fields. You might be going into dental hygiene or surgical tech or something like that. And other types of cases would make more sense. But it's just not my particular familiarity with medicine. So these are medical cases meant to show you how the basic anatomy and physiology that you're learning in this course relate to real world situations. Going into the test, I expect that you have read these cases and you can pull out necessary information. And that information is that you know the terminology about the case, which means not just definitions of the words, but also that you understand the specific jargon associated with medicine. Like you might know the word blood and you might know the word pressure, but blood pressure as a term unto itself has a very specific meaning. And when you see that in a case, that implies that you know what normal blood pressure is, how you compare the patient's values to that normal blood pressure, and what that tells you about what's going on. Also, you should be familiar with abbreviations and be sure that there are abbreviations that are relevant to the case. For example, in the autonomic case study, the abbreviation PAL, it's not in the case, but it's relevant to the case and the way it was discussed for the class. PAL has a lot of different meanings, like Pakistani Airlines, PAL, PAF, I'm sorry, Pakistani Air Force, which obviously has nothing to do with medicine. There's actually a medical version of that abbreviation that's not relevant to the case. So please be careful about what the abbreviations mean and that they're relevant to the context of the case. If you know the terminology of the case, you can understand what you're reading. Then you should be able to pull out a list of the symptoms and signs that are hinted at in the case. Symptoms essentially are patient complaints. Speaking of abbreviations, PT is an abbreviation for patient. But when a patient goes into the doctor's office and says, you know, I've had a cough for weeks or whatever, that's a symptom. Signs are generally exam results. Patients don't complain about high blood pressure. They don't know what their blood pressure is. But a sign of heart trouble could be elevated blood pressure. The point of symptoms and signs is really to get at what is the physiology that's at play in the case. So besides the sort of direct definitions of symptoms and signs, also pay attention to what's given in the histories within the case, if there's anything. Medications can tell you something about what's going on. People are taking medications because they have situations. Somebody might take Tums or something like that and not really mention it because they take it all the time, but they're probably taking it because they have some problem with their stomach. So pay attention to those kinds of things. And then you should be able to list what systems each of those symptoms or signs is tied to. So if somebody says that they have a cough, then that would be the respiratory system. Or if somebody's taking Tums, that would suggest that there's a digestive system issue at play. This is just a straightforward what anatomy is attached to the physiology that's at play. It's not a matter of trying to figure out what's going on necessarily. If somebody has low blood pressure, it might be caused by some other system, but it's a cardiovascular issue. So just to direct what's going on in the case. I anticipate that anybody coming into my test knows this information about the cases that you've been given beforehand. Now, the day of the practical, when you come in, you'll be given a stapled sheaf of papers, which is the test that you'll be taking that day. At the top of the page, it will say Practical 1, A&P 2, and there will be a place for you to put your name. And the first thing you'll see is exactly what's on the page here, case 1. And that'll be followed by the questions on case 1. And then you'll see case 2 followed by its questions, and case 3 followed by its questions. The test is a 50 multiple choice question test. 50 does not divide evenly among 4 cases, so roughly 12 or 13 questions per case that you'll be answering. Now, I like to describe the types of questions you'd get this way. There are 3 types of questions. Now, they're all multiple choice questions. What I mean by types is first are questions about the case, which is to say, you should be able to tell me anything about the terminology, the symptoms, the systems, or the underlying A&P for the case. If somebody's coughing, I might ask what type of cell produces the fluid that's being coughed up. That would mean that you understand that in the respiratory system, mucus is made by goblet cells. And so you'd say goblet cells. Now, of course, that question would be followed with 4 choices. So it might be what type of cell makes the fluid that's coughed up by somebody with a respiratory cough. A might be squamous cells. B might be, goblet cells. Got to put that in there. It's the correct answer. C might be mast cells. And D might be white blood cells, something like that. So the obvious correct answer there is the goblet cells. Those are cells that make mucus in the respiratory epithelium. Now, that's an example that I can just pull right off the top of my head and fits in with the example of the symptom I mentioned earlier. But of course, this particular practical is not about the respiratory system. So don't get too worried about that. Second are what I call questions not about the case. Now, it might sound between those two that I could ask anything in the world, questions about the case or anything else that I feel like. But really what I mean by this is each case is about a particular part of the course. And I might want to ask you questions about the course that aren't directly related to the case. For example, case 2 is about diabetes. If I'm going to ask you questions about the case, I'm only going to be asking you questions about the pancreas and insulin and glucagon. But I might want to ask you questions about other aspects of the endocrine system. So I might want to ask you about the thyroid or parathyroid and calcitonin or parathyroid hormone, et cetera, et cetera. So I need the latitude within the test to ask those other types of questions. And then third are what I would think of as the more traditional practical questions, which means those are things that are based on models or specimens, microscope slides, something like that, from the material that the course has been going over. Now, I'd like to say that those questions are going to be relevant to the case, like for the diabetes question, if I'm going to show you a microscope slide, I'd like to say it'll definitely be a microscope about the pancreas. But for the endocrine material, multiple things were covered. There are microscope slides that were presented for the course, and you can see them linked in the endocrine system folder on Blackboard. There were slides of the pituitary gland, and tied to that is the hypothalamus, and the thyroid and parathyroid glands, and the adrenal gland, as well as the pancreas. So while I'd like to say that all of the traditional practical questions will be about what's going on in the case, I might want to instead ask a question about the pituitary gland, for instance. I might show you the picture of the anterior and posterior pituitary gland side by side at 4x magnification, objective magnification, and ask you, of these two, which one is the anterior pituitary, the dark one or the light one? Which gets at how that material is presented in class. Now, I believe that question is actually a question off the endocrine system lab quiz, essentially. But I could ask that kind of question. Some things just lend themselves better to the traditional style practical question. They might not exactly be about the case. Now, thinking about the 12 or so questions that you're going to have about a particular case, if you imagine that we're talking about 4 questions about the case, 4 questions not about the case, 4 questions that are more traditional practical questions, then you would expect that the majority of the questions on the multiple choice test are about the case. There will be a few that are not about the case. Probably in a dozen, 8 to 10 are directly about the case, and 4 to 2 are not about the case. Most of what you're going to be studying and preparing yourself for is based on those case studies. Talking about studying, I've also provided an outline here. Now, personally, I'm not really an outline kind of person. When I was a student, I didn't use outlines a whole great deal. When I had a writing assignment, like in my English class, and we were supposed to turn in an outline of the paper before we completed the paper, what I'd usually do is I'd write the paper and then backtrack and figure out what the outline would look like for that, or something like that. I just wasn't keen on outlines. And so I started including them because I had students ask me to provide an outline. Now, when I provide an outline, this is not supposed to be, here is a legal document of everything that the test is going to be about. Really what it is it's a thumbnail sketch of what we have covered at this point in the semester. So if you click on this link, you'll get to this outline. It starts actually with a few things that you should recall from A&P 1, just basic information about nervous tissue. And then it goes on to explain the autonomic system. The disorders that are listed here applies to the case that is tied to the autonomic system as far as the class is concerned. And then I have special senses. Now, technically, special senses is covered in the class the week before the autonomic system. I used to do it in the other order, and so that's how the outline's made out. But this goes through and explains the structure of the eye and the connection back to the brain, some things about the ear, et cetera, the vestibular sense, which is also based on the inner ear, all that there. And then the endocrine system, just a rundown of everything there. I used to go into more detail about the endocrine system, but nowadays I really just stress the hypothalamus, the pituitary gland, the thyroid gland, the parathyroid glands, the adrenal glands, and the pancreas. Those are the things that I have microscope slides to address. But there are a few other things here. The thymus really isn't covered in this class until the immune system, and the gonads are the main focus of the reproductive system. So I really don't cover those until we get to that part of the course. Then the circulatory system, blood, heart, and vasculature. The point behind this is, again, it's a thumbnail sketch of what the course has covered up to this point. You can use this as a study aid along the lines of, as you're reading through this, the things that you understand and feel comfortable with, you probably don't need to spend a whole lot more time studying. But if you get to something that sounds completely brand new to you or something like that, that probably means that you need to go back and look at the original course material and study that in more depth. Ultimately, the outline is a picture of the breadth of everything that you should be prepared for in this case. Okay. However, the way that I've constructed the test, I'm also telling you what I want to concentrate on more in the sense of what the cases are about. So as you're studying, make sure you're very familiar with the cases and you're ready to address the basic A&P for each of those. If you have a limited amount of time to study, concentrate on what the cases cover first and then move on to other things. Now, for the autonomic system, disease in that case is about the sympathetic system, so be most familiar with the sympathetic system. But you can bet that there are going to be questions about the parasympathetic system on the test also, just fewer of those. Case 2 is about diabetes, so you better know the pancreas and insulin and glucagon inside and out. If you have time to study more about the endocrine system than that, please move on to the pituitary, the thyroid, the parathyroid, and the adrenals. But really, there's not a whole lot of reason to go into other parts of the endocrine system because it's just not something that's stressed in the class. I can't promise that there isn't one question somewhere about something out there, although I really doubt it. So concentrate on the cases and the things that are stressed more within the context of the class. But ultimately, you should be completely familiar with the entire system. Now, for the cardiovascular system, it's a little hard to say, study this more than that, because one's about the heart, one's about the blood, and you sort of have to know everything about that. I suppose in malaria, the disease is directed more at red blood cells, so pay a special attention to that as opposed to white blood cells so much. And then for the blood vessels part of the story, pay most attention to the blood vessels that are attached to the heart. And then as a hint, for the blood case, to tie in the blood vessels there, I address blood pressure. So be sure you understand what blood vessels are most directly with measuring blood pressure. So you have that. Now, that's the in-class part of the test. It's 50 multiple choice questions that you'll be taking that day. It's designed for you to complete within about an hour, but you will have an hour and 50 minutes total if you need it, which is the traditional length of a daytime lab class. So it'll start at the traditional time for class to start, but you will definitely be done within 2 hours, hopefully sooner. That's all that I would expect you'll be doing that day. Your lab instructor might have a different opinion about that, although I doubt it. So you should be able to finish up early for the day. That's 1 point per question for a total of 50 questions, but that's not the entire test. There's another part of the test, which is this assignment right here. There are 16 more questions, the first 4 about case 1, the second 4 about case 2, the next 4 about case 3, and the next 4 about case 4. These are questions that are generally more like a part 4 assignment, as you've been doing in this course all along. They're open-ended questions for the most part, or maybe some fill-in-the-blank things, but there are those questions. There's no timer involved. You can go in and out of this assignment as much as you want to. It's due before the class the week after the practical. You're welcome to open it up now and look at it if you'd like to and answer any questions that you might be very familiar with. But the intention had always been for it to be a test that you take in the week after the practical. So you should be able to complete that work in that week. You won't have other material to do that week except for the reading in preparation for the next week's class. So you should have plenty of time to work on that stuff. Those are worth 2 points apiece. Grading those questions is a little bit more simplistic than grading a 6-point question on a part 4 assignment. On a part 4 assignment, if you get things mostly wrong, but there's just one little problem I have with it, I might take a point off or something like that. With this, I only have 2 points to play with. So basically, if it's a good answer to the question that's thoughtful and pays attention to what the question asks, you're likely to get full credit on it. If you answer the question passively, and there's some question on whether you really understand what you're talking about, or you over answer the question, like I ask you something about the cardiac conduction pathway and you tell me everything you know about the heart. If you answer the question, which means that you didn't read the question, didn't understand what I was asking, or it's a fair to middling question, you'll get one fair to middling answer, you'll get 1 point. And then if you're completely off in left field and it's obvious that you're grasping at straws or didn't really think through the question too much, you won't get any points. I would say, and I've actually not sat down to do the math, but I've always had the impression that about half of my students tend to get all of these questions correct. There's 16 of them worth 2 points apiece for a total of 32 points. So probably about half my class gets 30 to 32 points on this part of the practical. Now, 50 multiple choice question tests, each one worth a point, 16 online questions, each worth 2 points, which adds up to a total of 82 points. The practical is in fact only worth 75 points, which means if you earn more than 75 points, 76 through 82 points, those extra points are extra credit in your lab score. Now, truthfully, very few students will be in that situation. So for the average student, what it really means is there's about 7 or so points worth of questions that you can mess up and not really have any questions, any repercussions from. For instance, if you come in and take the in-class practical and you get 38 of the 50 questions correct, that's 76%. And students will go, oh my gosh, I've got a C on the test. But if you then go to complete the work online, you get 32 points on that, which is not impossible to do if you're thoughtful about answering those questions. Then 38 plus 32 is 70 points. And 70 out of 75 is, I can never remember if it's 69.5 or 70.5, but it's right on the cusp of what would be an A minus A for the test. So the extra points built in really give you a bit of leeway, and most students will appreciate that, and they might have a problem with the in-class portion, and so there's a little buffer there that you can miss several of those questions and still be in striking range of an A. Now, I do want to say specifically this: students often hear, I can get a C on the in-class portion and get an A overall in the test. No, you have to work hard on the online part. You have to pay attention to what the questions are answering and answer them thoughtfully to get those points. You're not guaranteed of seeing an increase in your practical exam score of 2 letter grades. Okay. Also, I'm using C's and A's and percentages to explain this, but really within the class, everything is based on points. So you get 38 points on the in-class portion and you get 32 points on the take-home portion, and that adds up to the total number of points that you get on the test, which is out of 75. That's really how it works. A lot of students after the in-class portion will text me or email me saying, oh, I feel like I completely messed that up. What kind of grade am I going to get on this? My response is always, the test is not complete until I've graded the online portion. So please don't freak out until you do that. Just put your all into that part of the assignment and you're going to maximize the grade that you can get. So that's going to be my response if you get to that point. Now, for the sake of this section of A&P 2 that did not have me as a teacher for A&P 1, I've included an example practical based on one case from one of the second A&P 1 practical that I give, just to give you an idea of what the test looks like. So if you click through here, first off, there's just an explanation of what I'm talking about. Any question that says station whatever at the beginning, that means that you're going to go look at a traditional practical type question. Okay. The case will be on the test. So here's the case that these questions are based on. It's just one of the 4 cases from that particular test. Now, the way that I put this on Blackboard, I can't have the case up on the screen while you have the questions, but you can always go back and see that. So if you go on to the questions, it's an assignment built into this. It's not an assignment that's part of your grade, just set up so that you can see if you understand how everything works. So you launch it, it gives you the click-through page. I have set it up to allow you to take multiple attempts, which means that if you do it once and you're like, I didn't quite get it, you can go back and try it again. Again, this has nothing to do with your grade. It's just an example test for you to try. And you can save your answers and come back and look at it later, which you might want to do if you want to jump out and look at that case again or something like that. So these are the questions, you just put them in. This is an example of a station question, question number 3. For the practical it comes out of, it's station 3 because it's the second case in the test. And this is a micrograph. So you'd be looking through a microscope to see this. And I've painted on top of this a black bar representing the pointer that you would see through the microscope. So there's a question here that's just asking you what type of tissue you see in the field of view. Then the next question, it still says it's about station 3, is the one that actually has to do with what the pointer is pointing out in this image. Okay. And then later on, there's another one. I pulled a picture off of Google image search of the leg model like we have in our lab. And again, that's for this A&P 1 practical. You do not have to be concerned about the leg model stuff for this test because it's none of the cases are about the musculature of the leg. But station 4, what muscles indicated by the flag. And so I painted a pointer on top of the picture to indicate where I would put a flag, a piece of tape on the model. And then the next question is still about station 4. So it asks about the muscle that's the answer to this. Now, if you get this question wrong, if you incorrectly say which muscle that is, then you go on to answer this, you might have a little bit of a problem. So if you thought that that was the erector spina for some reason, I don't know why you would, because spina obviously is referring to the spine, which is in the back, not the leg. But that's the answer you put. And you get down here, none of these answers make sense because your answer to the previous question is wrong. So if you run into that situation where there's a follow-up question on a traditional practical question that doesn't make sense, go back and look at the original question. It might be that you answered that wrong and you've set yourself up to be confused by the next one. Okay. So those are questions. While I have it on the screen here, this question here, what does tensilon do, is just directly making sure that, where do we want to go? That you've read the case, because the case has reference to somewhere in here, tensilon. Okay, just trying to scan through quickly. There it is, under the laboratory findings. So it refers to a tensilon test. So I would anticipate coming in after reading this case that you did in fact look up what tensilon is, what the tensilon test is, which falls into the definition or jargon aspect of what I said. So this is here so that you have an idea of what you need to do to prepare for the test. And this example practical is exactly what I would have given in A&P 1 for the second practical, one of the cases on the muscles. And most of my A&P 2 students would have had that experience. So I figured I'd put it in here so that you could see what it looks like there. Okay. So I hope this explanation has helped you understand what you have coming. And you'll be able to study. I've given you basically all the information that I would have given any of my students that I had in a lab section that I taught myself. If you have questions that you want to follow up on this with, please feel free to text or email me those questions. I see that I get contacts from a limited number of people within the class. I don't know if that's because people are unsure of whether they can ask me questions or whatever, but please, part of my job is to help you through this class. So if you have questions, contact me. I'm not going anywhere over spring break exactly. I am going into the hospital on Friday for what I really, really hope is a minor thing. But I really, really hoped that I was going in for a minor thing before last semester. So I should be back home for the following week, and I'll be basically laying around recuperating from that procedure for the rest of the week. But you're welcome to text or email me. If I'm in the hospital over the weekend and you text me, I should be able to respond to you pretty easily. I'll have my devices with me, and I'll probably just be laying in the bed for a day or so after the procedure. If I don't get back to you quickly, that might mean that I'm not in a position to answer questions, and I'll try to get back to you as soon as I can, hopefully within 24 hours. So I hope all this helps everybody understand and feel more comfortable what's coming on the practical. If you do have questions, feel free to contact me directly. And otherwise, have a nice spring break.